image I like for the visual.
Visuals.
So if you're, if you're more of a visual learner, I like you going in there and looking and kind of, comparing, seeing how it works. Because, even your book diagrams, they're decent, but they're not like that visual you can get with two-fold exchange, which is why I like that for the visual learners. But for information-wise, and I think that's pretty much everything else on here we already went through. We talked about cementicals.
So how will we know on the outline what we don't want to know?
For your outline, that outline, you pretty much need to know.
Know it all.
Yeah, that outline is for you. I mean, so like some of the stuff that if I never touched on it at all, or if it's never like in your book, the majority of that you need to know.
Okay.
So, like how Jennifer was bringing up the blood vessels, that's great information that I can pull. So just knowing certain aspects of it, and it's for you, especially for this test, you have it right there. So the things that you do not know, like in split second, highlight those for references.
Okay.
So you can easily go back to.
So, which of the outline, like, what's gonna be on the test? Like enamel, dentin, cementum, fold,
Right.
and then
PDL,
yeah,
and then you have your,
fold.
yes, all of that. So so chapter 9, 10, and 11 are all gonna be on there as well. But like I said, chapter 10 is going to be, and we're gonna go over that, it's gonna be very condensed because a lot of chapter 10 is what we're going over when we start talking about the teeth itself. So a lot of that I really don't need you to know right now, but I need you to know like certain things.
Touch it.
Right, I mean, that's what we have our models out right now, so when I tell you to take out your mandibular, central, and lateral, seeing which one is bigger and smaller, getting that in your head so that you can kind of know, have a baseline of going into what we're gonna be talking about.
So as long as we're following this, filling in, we know the information on here, look at the information here, look at that, we should be good.
You're gonna
Okay.
be golden.
Okay.
And like I said, this test isn't really bad at all because you already know about cementum, dental, and enamel already. So we're not going into the histological
building
part of
on
that.
it.
Yeah, we're just building on what that is. So the histology and embryology of that we've already gone over. So now we're just trying to get into what the tooth actually is and how it's when it starts coming into contact and what gives us that sensation and how the tooth functions. So knowing where everything is at now, we don't really need to go back and touch on the embryological part of it. It's just knowing what it's made of and what the function of it is.
But will you have the questions like the 96% organic, like the percentages of each?
So for the,
Okay.
that will be on there.
Okay.
But the main thing for that
percentages.
is when we start going over, so like there's a question on there that I know definitively, I'm still trying to get some of my questions together, but definitively, it's gonna not have the 30, 10, and 60, but it's gonna have the words of how, the overlapping, or this comes with here. So not even knowing any more about that 30, 10, 60, because we already know that. Now I want you to be able to look at it and see, okay, if I'm in there with a scaler or with my Explorer, what am I feeling? If I can feel this, what exactly is it? Because now we're past that. We already know what that's made of. Now it's kind of us getting in our mindset of how this may look when I'm going into tactile sensation and trying to feel around. All right, let's go into clinical considerations. Okay, so the main thing with these three is just to pretty much know what's on the PowerPoint, in which I will, one PowerPoint, two of them are like 15 pages, and then the one that has the 30, which is the tooth ID, there's only like, I think, 5 slides. I really want you to focus on that. So this is not really anything that's gonna take up a lot of your study time. It's just stuff that you kind of just already are going to know, and it's gonna be second nature to you, but just kind of going through everything. So when we're going over the clinical experience of what we have, we know that preventative care is the best that we wanna go after. We don't wanna go into pathology, because pathology is just letting us know that there was a lack or something wasn't being prevented at that point. Something wasn't caught, or that something wasn't actually dealt with at that time. So our main goal when we're talking about clinical experience is preventative. We wanna make sure that whether it's hygiene or whether we're seeing any type of lesions or any type of radiolucencies on the x-rays, that we're catching that and bringing it to the patient's attention, especially here while you guys are in school, because we don't have a dentist or a dental, we don't do any type of restorations here. So the main thing that we can do is when you're looking at these x-rays or you're seeing any type of abnormality when you're doing your IO is to, mark it down, bring it to someone's attention, and then so we can inform the patient so that we can actually get ahead of it instead of it letting it get out of control and the patient eventually may lose their teeth. So considerations when we're talking about this is, the tooth form and shape, and then dental problems. So anything going on, whether it's dealing with trauma or decay or any type of lesions that we're seeing, we want to make sure that we're catching this early enough so that it doesn't turn into a problem. Because once that bone is destroyed, we're not getting that bone back because that PDL is now separated. We don't have that connection anymore. So that bone is no longer there to make osteoblasts to fill in there because there is no stretching or compressing. It's just gone. It's just space. So when we're talking about decay and periodontal disease, we're looking at the bacteria. So here, when we're looking at our restorations, and there are some good pictures of this in your chapter of just overhangs and of the calculus, and I'll let you guys just kind of look at it in your own time. But I think it's on page 88, and then we're going to talk about 89 as well. When we're seeing overhangs, what is an overhang? Any of my assistants know?
Oh.
Like when the filling is like past
The contour. So we have our contour of our teeth. So we have our mesial distal contour, whether it's lingual and buccal. And that restoration, whether it be the crown or it's the filling, is no longer adhered to that contour. So whether they added in too much material or, or it's just kind of the contour, or even when we have like a stainless steel crown. So when you guys go further in there, you'll see a stainless steel crown. It's not going to fit like a porcelain fused to metal crown, where it hugs and is contoured to that tooth. The stainless steel crown, usually for kids, just kind of fits over there just to give us some time until that tooth exfoliates on its own. But our main thing is just to make sure that these areas, like our overhangs and anything else, are traps. It can trap food and debris and bacteria underneath it, which can eat away at our PDL and cause bone destruction as well. So our job is to make sure that we're looking at these radiographs and seeing anything like this. So of course we want to look and see, like on page 88, figure 9.1, on tooth number 15 at the top, that's a great example of an overhang, where that is way too much amalgam composite or amalgam material that was not adhered to the contour of that tooth. So all that's going to end up happening is that food and bacteria is going to trap in there, and you're going to get more vertical bone loss. You can see there's already horizontal bone loss, but we're not seeing that vertical bone loss right away, but it's going to come if we don't get that fixed. So when we're looking at also accumulation, we have our pits, so that's why we do sealants. Any deep grooves or pits, those need to be taken care of. If we see they're stained, we make sure we're getting our Explorer in there and we're checking it to make sure that any food debris is out so we can seal those areas, because those are just potential hazards for caries. Also going to happen is that it's going to be an anaerobe environment. It gets down into that pit or that groove. Food gets in there, it can't breathe, it just that bacteria starts to multiply and then starts to eat away at the enamel. So sealants, what's a sealant?
Protects the tooth from decay.
Right, so it's one of our major, protections that we have for our pits and grooves. So our pits and fissures are our little lines in there that we do for sealants, which you guys will be doing a lot of when you get into second year. All that is protecting that tooth, and that's why a lot of times we do it on kids, because mostly kids will have a high carcinogenic diet, or they're more carcinogenic, and then the foods that they're eating are like these processed chips and crackers, which then breaks down into sugars and then eats away the teeth, especially if it's not removed. So our job is to look at that to make sure that we can be preventative by doing sealants on these kids or even adults who have deep pits and grooves. So natural teeth, when we're looking at this, we're looking at the occlusal trauma. Spillaways. Spillaways is another word for embrasures. You guys remember embrasures from our first? What is an embrasure? Space where?
Between.
It's like below the knuckle.
Right, so we have our contact, and then right above it, we have that space that comes out here, and then right at our incisal edge or our occlusal, we have that contact that comes outward. So that's where our spillaways are, which is another name for embrasures. With that, that's helpful when we're eating food, so that food is not getting caught in those areas. That's why we want tight contacts. If we have a tight contact, we don't have to worry about food getting entrapped in those areas and causing interproximal decay, because we know our patients are not going to floss as regular as they do. So the whole thing is that's what the spillaways or the embrasures are for, to make sure that food is kept from those areas and that's why our enamel is made up the way that it is. So going into contours, I want you guys to look back on page 39 in chapter 3. And you're gonna look at figure 3-11. This is an excellent picture of what this looks like. So we're talking about overdeveloped and underdeveloped contours. We're looking at the contour of that too, which goes into when we're doing our crowns and our fillings. And we wanna make sure those contours, whether it's buccal, lingual, or mesial and distal, all those contours we're wanting when we're doing restorations. Because if not, we're gonna have gingiva trauma. That food is gonna wanna push up. So when we have it underdeveloped, that means it's just flat. We don't have really a good contour. And, yeah, I'm sorry, 31. Did I say 39?
Yeah, I was like,
Sorry, 31. So 31, when we have it under contour, which is like B, where it's looking like you see on the lingual side of that, that food just gets traumatized and go right into that gingival crevice, going right up in there. A is what we want it to be. We want that contour in our gingiva hugging so that nothing is getting trapped up in there. And then C is when that food is actually just kind of going and irritating it. We're having this bulbous gingiva that's being irritated because the food, the gingiva is already kind of, the contour of that is so bulbous that the food is going to be actually trapped on the top, or it can kind of get right in at the edge of that. Which if you're not brushing, because your toothbrush is not going to be able to get underneath there, even with the,
special.
yeah, what are you guys learning about? Don't tell Miss Campbell, because I brush my teeth like that. I use my sonic hair. But the jiggle and swipe.
She hasn't showed us how to brush our teeth yet.
Nope.
We're all just
I
hanging.
think it was scheduled for the first week,
Yeah.
and then
We haven't got to
been
it
pushed
yet.
Back and
Oh,
back and back.
alright.
So you're okay. We won't
Okay,
tell.
all right. Stuff in this house. Anyway, I want to pass on that because I cannot think of the name of what that.
Modified badge.
Modified bass. There we go. Who said that? Emily? Look at you. All right. So modified bass, jiggling, swipe down, jiggling, swipe up to get it at the
What?
gum line. Even that, yeah, is stimulating the gum, and then swipe down. You'll get into it. But with C, you're not able to do that because the gum is so bulbous. And when it's bulbous, you're not able to get underneath there, and you're not gonna be able to push that up, which is why we have other adjunct dental aids that we have and tell them about the water pick or proximal brushes to kind of get into those. So development of contours is very important when we're talking about restorations or when we're talking about the natural anatomy of that patient's tooth. Because if it's naturally bulbous or it's naturally developed, then there's things we're gonna have to do because we could lead into periodontal disease if it gets trapped underneath that gingiva. All right, maintaining restorations. So this, making sure that we're actually not going, well, and then we don't really do this at all, but when you're with your patient, making sure that when a restoration is done, that it's not close to that pulp. Because we went over last week or the week before last, any type of drilling that gets close to that pulp is going to irritate that pulp, which in that secondary or that secondary dentin starts to form. And then
Makes the pulp chamber smaller.
right, it starts to shrink the pulp, and then we're going into another issue because if that pulp starts to shrink, then if it gets small enough, it becomes non-vital. What we can actually do is end up choking that pulp, because think about it, we have that pulp and we have that dentin. Dentin is hard tissue, correct? There's no area for that pulp to inflame. There's an inflammation, it's just our body's response to any type of traumatic event. So since we can't, our pulp won't do that because there's not enough room in there, it's gonna end up choking off that pulp, which then can actually in turn kill and make our tooth non-vital. The only openings are apical foramen that gets down there, but there's not sometimes enough inflammation or drainage to get it out there, and at that point when we can get bacteria. So if we have this pulp that's throbbing and beating and they can feel it, it's because there's not enough room in there for that pulp to actually heal itself through inflammation.
Will that didn't keep going if that's throbbing like that?
Yes, because it's triggering.
So, because every time it's
If
going,
you think
oh,
about
let me
it,
go.
Right.
Oh, let me.
So it's right. So it's just a constant issue going on. Now we know it doesn't happen like this.
No,
it's
but
not immediate. But over time, it's just
gonna
keep
choke
going,
it.
right, and it's going to choke off the supply of it.
And a person would feel that as a toothache, right?
Right. I mean, as a huge toothache at that point. And then, if anything, it's going to try to alleviate it through its apical foramen, which is when we get these periapical abscesses, right down there. Because our periodontal abscesses are going to be on the side of that, root, or the kind of close to accessory canals, but like on the side of it. and our periapical abscesses are right there at the bottom of it. It's all
So is
about
that when they
location.
get like way down at the bone line is when it starts
So
to
when you
get
start seeing that little pimple, where
Yeah.
that fistula starts to grow,
that's
yeah, and they come in
Ew.
there and say, oh, I just popped it and it went away and it's fine.
Oh.
Yeah, it went away, but it's gonna come back. Because number one, we didn't have any antibiotics to kill the bacteria.
and they just pretty much just drained what was on the surface.
Right, and that's all that's happening. So you have to get in there and figure out what's going on with the pulp, and then which more like you're gonna have to have done is endodontic therapy.
Or would they just extract it if it was too
A
far?
lot of times they try to do endodontic to save it, because our whole goal is to save
Save.
that tooth. Because other than that, you're gonna need something in that space.
But people that are on, like, I know a lot of people that have toothaches, they'll go to the emergency room if they don't have insurance. Do they then just go to the dentist and be like, just take it?
A lot of times, and you'll see that here. When you start seeing your patients, and they'll be like, yeah, it hurts, but they don't have the money.
Yeah.
And
So
you're talking
this
about
cheaper just
endodontics.
to pull it.
It is cheaper, and especially if it's done and if it's not successful. So here you are, you've already spent $1,000 on endodontic therapy, plus you need a crown, and your crown is probably $1,200. And then the tooth fails itself, and then eventually it has to be,
Yeah.
extracted anyway. So a lot of times you look at it and you're like, well, I don't have that money right now, so they pull it.
Do people pull their own teeth?
Yes. And you will hear that too. They will get their pliers, they will get their Jack Daniels, they'll liquor it up, and they'll yank it out.
my.
And they have no problem telling you. They will tell you that that's how I pulled my tooth. I pulled my own teeth, and it's just like, okay.
Okay.
Looks like you got it good, so.
Do you need a job?
They dentistry without a license, but whatever, it's your mouth, you can do whatever you want.
Yeah, but if you're in that much pain, that pain probably don't even hurt if you're in some awful.
Cause any?
Yeah,
Well, if they
infection.
leave part of the root down there.
Or if it
yeah,
breaks-
or if
breaks
it
off.
breaks off, and then, yeah, there are all these different kind of traumatic events that can happen, but sometimes if it's already, if the periodontal ligament in the bone is already destroyed around
just-
there, you
it's
can
gonna
just go
pop
ahead
right.
and pull it out. If that, or if, but the thing is, if it's severely decayed, they can't get a grip of that. So
It's
the
just gonna
crown will come
crumble.
off and it will crumble.
Crumble.
But that root is going to stay in there. And they're fine with that as well, because it's going to seal off on its own, why they keep, eating on it, and that, or the gingiva is going to go over it and seal it. They don't care, as long as they're out of pain.
How much, okay, this is a random question, that's okay. How much does it cost to extract the tooth? Like, what's the major difference? Oh.
Right.
Cheap.
Because in that case, you're not talking about oral surgery. So you're just talking about a simple extraction. Or sometimes it could be a little bit more involved in a simple extraction, but it's a lot cheaper than getting a root canal and a crown.
And people
then
are,
plus a buildup.
if they don't have any money, that's,
Right, and then insurance, which is not really insurance, it's more of a benefit. All it really does is just cover 50%. And if you don't have, who has 50% of that just right there waiting? In this day and
But
age, it's really hard.
is, even if somebody doesn't have the money, it's better to get the tooth out than leave it in there to keep.
100%.
So, if push comes to shove,
You are going to
that's-
get it out,
yeah.
and then you never know what happens down the road. Down the road, we can go ahead and maybe do an implant. You can do a partial. You can do a bridge, but that infection could kill you.
That's gotta get-
So we're
get
getting
it
that
out.
infection out of there.
Okay.
All right. Pore biting. So cheek bite or cheek biting. So how do we check the occlusion after we've done a restoration?
the little paper,
little thing.
the paper.
Articulating paper.
Yeah.
So you're gonna put that articulating paper in there, they're gonna bite down, they're gonna grind, you're gonna see any little blue areas. You're gonna do the same thing when you're doing sealants, because if you have a high sealant in there, and it is not self-adjusting, which even self-adjusting sealant is not really self-adjusting sealant, so you have it in there and they're chewing and they're like, oh, it feels great. I always tell them and everyone else, sit your patient up, put that articulating paper in there, because if they're laying back, everything is gonna feel great, because that's not the way that we chew and we eat. Not unless you have a death wish on you. So if you're, sit them up and have them chew and chomp, that way you can look, and that's when you're having a better idea of where they're at. But get that articulated paper out. Anything that shows up blue, we need to adjust, especially on that material. Adjust it. If not, you're gonna go into TMJ issues because they're hitting high, and it can go into occlusal trauma because, right, go into occlusal trauma because that's not their ideal bite. So what's gonna happen is that the body and the jaw is gonna wanna overcorrect or, correct itself, which can then cause that TMJ issue. Then they start having the clicking, then they start having the toothache, then they start having the pulp start to inflame. Everything is going on because they're hitting high. So it's very important when you guys are doing your sealants to get that articulated paper and check. And also floss and make sure you haven't sealed their contact area.
I was just gonna say that, I had sealants done a couple years ago on one tooth that had just never gotten sealant. so they put it on there, but they never did that paper and everything. And I know, like, when I said, like, I was biting down, I said, you know, it feels like really thick. And she's like, it'll wear down, it'll wear down. And then, like, I couldn't even wear my top retainer because of it, and I still can't because it's, I mean,
You never had it adjusted?
No.
Go get it fixed.
You should
I know,
have,
you can
yeah,
get it
maybe the
fixed,
You
but-
need to
dentist
just come in here and
It'll
Dr.
go down.
Glazer will just
He
go
doesn't
ahead
make
and.
I don't know if
fine.
it's like, I don't know if my teeth have shifted so my retainer doesn't fit.
Well, or if it's still right, like.
You can just look at it and test
Yeah.
it, I'm pretty sure.
Yeah, you can-
Things on my-
Have you already had your teeth cleaned?
Mm.
When are you scheduled for that with your big? You need to get scheduled.
I'm
You
trying.
tell her to schedule. You just
Yeah, you go to your big and you tell her to
I've been
schedule.
asking her, she won't do it.
Who's your big?
Alan?
I have the same one.
Oh.
Yeah.
And I'm not yeah, we have the same
Two?
thing and she hasn't.
Didn't she reschedule y'all anyway?
Yeah, she rescheduled us.
She's never
She had a
contacted
patient she
us
had to
again.
finish, and then she still
I'll
has.
talk to Alex. It's Alex. You gotta love her. But yeah, so when you're in, make sure that that's one of your things that you put on your health history. That I have a high,
Yeah.
that's your dental
I wanna check
concern
for
that I
that.
need for this checked. And you give the tooth number
Okay.
and you say I need it checked. So that Dr. Glazer, or she needs to check with articulating paper and Dr. Glazer needs to come and adjust it.
Okay.
You should never leave anywhere.
Yeah.
And the only reason that you would is that if you're numb and you don't have a good gauge on how you're biting.
Yeah.
Other than that,
And I was younger too, so I knew nothing about it. Like, I just believed him, like, oh yeah, it's gonna go down after a while, after you chew for a while.
and a lot of things is when you guys are doing sealants, well, here it's different because you're checked every single way, and we check you, and then Dr. Glazer checks you, but in the real world, when you're out there doing it, you know, you may have 12 sealants to do, added on to a 10-minute appointment. So sometimes they'll just go in there, instead of making sure it's in those pits and fissures, they're just globbing it on, scraping it
And
around,
hoping it.
and curing it, and saying, okay, it'll adjust over time, but it's not. It could be very traumatic for you. And you can also end up fracturing that tooth if you just keep hitting on it so hard, you're just
Yeah.
causing trauma over time.
Yeah.
So
I
it's
think the
definitely
girl
good.
was kind of new too, so that kind of freaked me out when she
First told me that, I was like, oh yeah.
Well, you'll be in that situation,
I will.
so.
For sure.
All right, so, pain. So we already talked about pain and where it comes from, so that we know that our stimuli first is gonna come from our pulp. Our pulp is gonna give us pain stimulation. Our what's gonna give us pressure and temperature?
Our PDO,
PDO
and the gum.
Bone.
Bone. PDL and bone is gonna give us any type of stimulation or sensation to temperature and pressure. So anything that may be also off kilter at all, that's for us to actually either do a PA or follow up on with our patient. Tooth migration. So this is very important when a tooth is extracted and nothing is done to
Temp and pressure.
rectify or keep that space from that tooth, you know, moving over. So I want you to think. So I have tooth number, let's say we have tooth number 18, 19 is extracted. We're gonna go ahead and yank that on out. What's gonna happen to tooth number 18?
Super Wait, no, which tooth did you say?
So if I only have tooth number 19 extracted, what's gonna happen to tooth number 18?
It's gonna
It'll
shift
shift.
Shift where, which way?
forward.
Which is called what?
Mesially.
Mesially. So whatever that direction is, you know, we're usually gonna have our teeth, are gonna shift to fill up that space. Our teeth naturally want to fill in those spaces. That's why our teeth super erupt. So if we pull out one of our second premolar, we're gonna wanna fill that space. So that's why our teeth wanna go ahead and fill that area. All teeth always just wanna go ahead and just make sure that we have a good contact and close everything naturally. That shifting and that migrating is not good, because what's gonna end up happening is that it's gonna throw off your whole occlusion, and it can cause periodontal disease, it can cause caries, it can cause any type of gingival destruction as well. We're gonna have recession in those areas because our tooth is now no longer where it needs to be. When it starts to shift and tilt, you're no longer able to clean it the way you were used to. It's just, it becomes an issue. So that's why it's very important when we do have, or if our patient is talking about getting a tooth extracted, that we wanna make sure there's a plan B of what you plan on doing. What am I doing? That you want to make sure that that area is going to be saved. So like that's why even with kids, when we have kids get their teeth extracted prematurely, we put in space maintainers to save that space until that tooth erupts, because if not, everything is going to start wanting to collapse in and fill that area, which then prohibits that a permanent tooth from erupting into space, and it's either going to go buccally or lingually, which then he'll just be, or she will be an orthodontist's dream, because you have to make room for it. All right, so If it's not replaced, we have super eruption, we have migration, destroys effective contact areas, which once again, we can go lead into decay because you're not gonna be cleaning those areas effectively, and food impaction. So structures of it. So once again, when we're talking about having an antagonist tooth, we wanna make sure that our teeth are in occlusion. Same thing goes with super eruption or migration. This all goes in this whole area of making sure that we don't have that periodontal disease or periodontal bone destruction that can happen for teeth that are prematurely extracted. So like Natalie was saying, with her high sealant, or if you have a high filling, what that's going to do, it can throw off your TMJ as well, because your teeth are trying to find a way to fit naturally, and that's just going to cause, over time, you may hear that clicking. You won't have pain with it, but you'll have that clicking because your TMJ is overworking itself, and it's wearing down that cushion, which we'll get into when we talk about the TMJ. Prevention is best, and prevention is key. All right. Nikita, when are you leaving?
I'll be recording, yeah.
I've been recording the whole thing. Yeah.
All right.
I've already
Let's
put the first.
power
I got a
through
print off.
this so I can.
It paused it, but I already did that.
No. We'll stop and do Jeopardy really quick, because Kahoot is just going to be on the rest of this because I couldn't fit a column in Jeopardy for this. All right. So we're going to get into groups. There's 19 of you guys. 18.
18.
Well, Lars.
Okay, that's fine. So we'll start it now, and then whatever group, I'll get you in your group. If your group ends up winning, then you'll get the points as well if you start off. All right.
I'm gonna leave this up in the recording.
You have 6.
You guys want 3 groups of 6?
No, if you have 16 people, would you have 2 groups of 8?
You guys want huge groups like that?
What do you want, 4 groups of 4?
Yeah, you get more points.
Yeah, we got 2 people leaving. We
Bigger
only have
groups,
8.
then
Oh.
more people would get extra credit.
Yeah.
Yeah.
Yeah, I like that one.
What?
Like if we did
Half the
bigger
classes.
groups, then like for group 1, it would be 6 girls got extra credit instead of like 4 girls or 3 girls.
Yeah.
Yeah, I don't like it. We're gonna do 4 groups of 4, and we're gonna add you guys into one of the groups, and then, so when you guys leave. All right, groups. We have Caitlin, Emily, Nikita, Laura Lee. You guys can start moving around.
Did you remember that? 'Cause
Okay, y'all come over here because you Laura Lee over here.
Okay. Group 2, we have Julia, Jennifer, Sasha, Leah, and Kylie.
Well, yeah, definitely.
That's funny.
that's just like we roll.
Group 3, we have Jessica, Victoria, Vanessa, and Josie. Group 4,
Did you say you want me?
Mandy,
Yeah, I was like, oh, maybe.
Caitlin, Malia, and Natalie.
Would you mind the best
I'm
Should
ready
we
to
just-
look over the work. You're in our group too?
Yeah.
Us 5? Yep. Y'all want?
The only thing is, like,
Y'all want like, I've done well.
we have 5. See, did you put Nikita? You didn't put Nikita in them as the 5th person. See, you just pulled 2 out.
All right, I need. Who has, you have 5?
Yeah.
Yeah.
You guys have 4. Yeah, you guys, so I need either someone to join their group from here.
And I think they have 5. 1, 2.
Okay.
Y'all like huddle up so we can talk. Can you get 3?
Ah!
Yeah.
Oh, my foot! Stop putting my
Let's do this.
She's Nikita is the 2. Nikita is the extra one. So she just threw 2 people. So we had 5 people that weren't leaving. Nikita was leaving.
I gotcha.
So they need to be
That
in
makes
the group.
She likes us better.
Yeah, I'll be honest.
Okay. I understand. Just remember that one we're beating y'all.
Just remember that one.
Oh, wait, that's up here, we don't need that?
Y'all are smart.
Okay, I missed 13 on that test. I think you might
missed 11. I missed
See?
14. But
I
you did
changed
really
three.
good on the last test.
Yeah.
Didn't you?
No,
What'd
I
you
made
make on the first test?
88.
85 on the first test. I made an 81 on this one.
We didn't miss just one.
That's awesome. I knew it wouldn't be me.
I know. No, I looked back and I was like, oh yeah, I missed that, and that, and that, and that.
I changed them.
I did too. There was 3 that I changed. I would have got only 10 wrong.
Is Mandy?
She went to the bathroom.
Oh.
She's in the 5th grade. No, Hannah's in
Yeah, because all of them.
Alright, so this is how it works. We're gonna have 1, 2, 3, 4. That's how I have to keep it together. I'm gonna bring it up. Oh, hang on, baby. Oh, it's fine. Oh. She's in the meeting.
that group back there.
Oh, Caitlin's gone. Okay, she's in the meeting. Alright.
Hey, do you want one?
Okay. Alright, I'll stop.
I got one. Thank you. Okay. I got one. Thank you.
Because then we can write notes on the actual answer.
Wait. Ah!
Or pictures. We could just take
You
pictures.
talked all this over.
No.
Or you wrote this on the... Oh, it's on that outline. This is what we studied for that one quiz. I didn't go over it. This was TJ Maxx.
Yeah,
I remember it is kind of not really.
that reminds me, I should probably look over that.
Where was that? I don't remember where I was at. I was thinking.
Which quiz we did? Oh, this quiz. That one in biology we can look at because it was over 11th grade. I wonder if we can go back and look at this one.
Yeah.
We can. The one we took, remember, on the Dington enamel.
You should be able to go back and look at them. You just
Okay,
click on
because that
the
would
grade.
help.
Yeah, just
We
click
can
on
do
the
that.
grade.
Okay.
Yeah,
I turn it off.
I have to pee.
Sorry.
I do too.
Alright, we're gonna get started.
Yeah, I know.
You guys fill Mandy in when she gets set. So, second years are maybe perspectives. So I've had to use it so many times with them. Why is it not working? So what's gonna end up happening is that you guys are going to have 10 seconds to answer. So the fair way that we've worked out is that, so group 1 will go. Group 1 will pick which question that they want. If they get it wrong,
Then we can steal.
if they get it wrong, okay. If they get it wrong, what I do is I allow the next group to answer it. If they don't get it wrong, you guys don't get points taken off. If you guys get it wrong, you'll get deducted whatever points money that you went after. You have a chance to answer it. If you get it right, if you get the money, you don't get the points deducted though. And then you move on until someone gets it right. If the last group doesn't get it right, then I just get the answer.
Oh, I'm scared.
So that way it's kind of fair. Everyone gets a chance. Then from there, we just move on. And whoever has the most money at the very end.
When I get nervous.
Yes.
So it'll be to, like, is there times, or are we allowed to take pictures of, like, the questions? Okay.
I was just she posted them on our group.
Okay,
I
yeah.
love having that.
I know. I have it recorded too. That was a good idea. That
Oh,
was your idea, wasn't
You
it?
got it recorded.
That's good.
But just so you know.
Wait for someone else to keep time.
Yeah.
I have 8 minutes. I don't, but I don't care. So I'm gonna try.
Squirrel.
Yeah.
Let's go big. Let's go like
No.
cement to 800.
Oh, because we're gonna be negative 800.
Can we go negative?
Yes, if you don't get it right, you lose your money. No, don't go big.
Let's go little.
You start small.
Go little.
Alright, so after you guys read the question, or I read the question, then time starts, okay? Someone else will keep points too, because I didn't know to mess up that as well.
Okay, who's keeping points?
Alright, group 1.
Enamel for 200.
Enamel for 200.
Do you have to say what is?
Yes.
Yes.
Okay.
Alright, forms the crystalline structural unit of enamel.
What's the time?
What is it?
Yes. Just blurt it out there. You already ran out.
Yeah.
So
I've got to say it done.
Okay. What is hydroxyapatite?
wrong.
Oh.
Group 2. You guys want to answer?
Which one's group 2?
You guys.
Oh.
What is calcium?
Hold on, you didn't even discuss with the group.
We only had 10 seconds.
It didn't go yet.
Oh.
Oh!
Is it still going?
No, they're going.
What is a version?
Yeah.
Hey,
Oh.
what y'all saw? Did y'all already guess?
Go.
Oh, enable rod.
Yes.
Well, that's kind of close.
I don't even see that. Is there another name?
I don't know.
I'll just.
Well, one person get each sheet, so we're not.
Okay, I've got the poll.
I got 3 of them, so somebody want to take one?
Which one do you want? I'll take one.
Enamel.
Enamel 400.
They did.
That's what we were gonna say. I was gonna. We were gonna say that.
I know it, so it makes sense.
Oh, okay.
What do you want to
Can-
do? What do y'all want to do?
What are we looking at? 'Cause we got it.
Since we just did it. Yeah, because it's kind of fresh on us. I'm gonna do pulver PDL.
Alright, PDL 200? Okay.
Ligament surrounding the teeth that supports the attaches them from the outer bone and surfaces.
Oh, that's the apical. That's the periodontal ligament. It's the apical one, right?
Yes, sir.
What?
Blurt it out.
What is the apical? What is the apical fiber?
That sucks because then it gets a.
Is it not?
Yeah.
Correct.
Are you kidding?
That's what I said.
We was overthinking it. Cause see, I just thought that was too easy. I didn't even hear you say it. I just thought that was too easy to be the answer. I didn't even hear her say it. We were overthinking it because I thought that was too easy to be the answer.
That's why I was like,
I thought
what
that's
the
what it
crap?
was.
I was like, literally, what the crap?
I thought that was too easy to be it, but I knew it was.
It didn't say that. It said the ligament that is. There's only one ligament.
Alright,
Oh
well.
my gosh.
Say it, 'cause
I didn't hear you say that.
Cementum for 400. Consider primary cementum.
I did not think that this was going to be that hard.
Say something.
We're running on time. Say something.
We got, hey, sorry, you can say it. What is acellular?
I was either gonna be 50-50, so I knew they would get it.
So did we do this?
No, you don't. Yeah.
Yeah, we did.
Yeah.
If we don't get it right, it's our question, then we lose the 200. So we're negative.
All right.
Denton for 200.
Clinical appearance of the resorption process with endodentin. What does it look like?
Clinical appearance of the reabsorption process. Reabsorption process.
Clinically, so when it's resorbing, what does it look like?
Is that our timer?
Yes.
So we have to guess.
Yes.
What is the tooth more yellow?
What is the tooth more yellow? Clinical appearance of the reabsorption.
So I
Am I
for
stupid?
color, but yes, you're on the right track. But when it's resorbing, so what does it look like? Okay.
What is light yellow?
Cycling staining.
I was gonna say,
What is?
just said that.
You just like the answer without.
I know. I'm like,
Yeah.
so is it?
It's brown.
It's what?
Hmm?
I thought reabsorption. She said
It's
It's color. Yeah, no, they already had light yellow.
Can we guess again?
Yeah, without any points, but yeah.
Is it like opal?
No, but it's close. It's that pinkish color in the crown. So it's over.
So I don't see any of this anywhere.
It's gonna come down.
Alright.
None of these are in here.
Negative one.
Oh, it's us again.
I mean, group one.
it's
No,
group
Oh,
it's
it's like what?
The sensation of pain is felt in which part of the tooth?
The sensation of pain is.
Oh, whoops. Told someone else to keep time. I can't do this.
You got it. You got it.
This is.
What is the nerve?
Yeah.
Wait,
It's us.
You got it wrong?
They go next.
Yeah.
Where we go around. That's the only fair way to do it, Mandy.
We don't have buzzers. Got it.
I mean, we kind of
We
did
got it.
show it.
What is pulp?
What is pulp?
Anyway, okay, so do we gain our points back?
Zero.
No, we're at 0.
Wait. Yes. Oh, so we gained our points. We got our points
What
back.
was that one? What was the question worth?
That was
200.
Alright. 200, so we should.
So we were at 0. So now it's our turn again.
We're at 0.
Yeah. I just got on the negative.
Yes.
I was about to say, this is about to turn into a game
So
of
do you want to
negatives.
talk to me again?
Oh, is it our turn?
Yes.
What do you want to do?
More cement.
PDL 400?
PDL 400.
Okay. We're bound to get some right.
Alright, part of the periodontal ligament is noted to be wider in a healthy adult tooth. So where is it wider in a healthy adult tooth?
Oh my god, I think it's the absolute crust. The largest group is the most common. It's the largest group.
Outside.
I thought it was the alveolar crust group. I thought it was.
Say it.
Okay, what is the alveolar crust group?
No, but you're on.
I thought that's what it was, like the one I read.
It's probably just. Alright, where do you guys want to guess? The alveolar crust.
You should have told them. They should have just have to guess and
We're from second year. Oh, okay. Yes. No.
Okay, well then, what is that called? Hold on, it's probably in here.
She's not at all.
Yeah, you're right. It could be.
Okay, we're not gonna guess this.
Oh, okay. Alright, group one, you guys want to try?
We don't get points taken away if we
No.
don't guess.
If we guess, do we?
You don't get points anyway. It's not your point. So if you get it, you get it right. You get the points. But if you guess, you don't get anything wrong.
You don't lose
You don't lose anything. Group one, you guys have an answer for me?
Apical?
You're halfway there.
What was it?
Oh, you already ran out of time. Alright, it was the apex and the cervix. So 2 areas.
Oh my god! What is near the apex in the surface?
Alright, so group 3.
We got a lot of studying we got these. So that's why I can't.
No.
Yeah. They're not on these things.
Like, this is, if you,
Process of normal wear on the crown.
oh, well.
What?
That's an easy one.
What?
I know that because I have that.
Oh, it's you.
Alright, group 4.
That was
Enamel.
enamel 400. Let's not do PDL anymore.
I was just thinking because it was right on our
From periodontal ligament, partially inserted into both the cementum and the bone.
Is this just like?
No, it's the answer.
Okay.
So what is the collagen fibers from the periodontal ligament partially inserted into the cementum and the bone? What is it?
What is Sharpie's fiber?
What is Sharpie fiber?
Alright.
What's the difference between the
Alveolar fiber.
Yeah.
Dental fiber.
It says attached to cementum and bone.
So what that is, that's just pretty much the whole encompassing whole thing. Remember, that's the same thing as principal fibers. So now we go into what all of those. So that's the head of it.
Okay.
That's
Alright.
top of that five.
Group 1, you got this.
Okay, so
I don't want PDL anymore. No. I don't want that. Okay.
Alright, formed when earthworm epithelial sheath encounters a blood vessel is not yours during
but you know it.
Right.
Let me read.
Think wisely.
Oh, wait. Never mind. Hold on. Formed when during root formation.
Alright, give me an answer.
Encounters a blood vessel.
We can't think of the word for it.
Can you spell it?
Alright. Alright, group 2, you guys want to guess at it?
No.
No, I don't know what. I don't know.
You guys are good?
We're good.
Alright.
Wait, it doesn't hurt us if we guess.
No, it doesn't. Yeah.
Okay, then.
Wait, it's not your time, Andy. Cheating. Sorry. I'm really sorry.
Say it while you're trying to say it like you're really playing. We're putting more pressure on us. I can't hear y'all.
Alright, need an answer.
Oh, like
I knew that does.
You know, that thing.
it's in my head. I just can't think of it.
Hit her in the back of the head and it'll pop out.
Alright.
So do we get to guess?
Yes.
Okay, what is pulpstone? Is that what
Oh, there's accessory canal.
Is that the same as accessory roots? Is that the same as the accessory roots?
Accessory, yes. So,
Roots canal, same thing.
Well, no, not really. This is have an actual,
Extra root
extra root here. You have an extra canal.
inside the one root.
Inside of it, yeah. So
Oh.
that opening, you have an accessory canal. It can be put on the side.
So that doesn't open up to anywhere.
Yeah,
An accessory canal would not be.
You
can see it.
and then get more bacteria in it.
Oh. It is open.
Whoa.
Like it can be that close to the gingiva? With the foramen and everything. Crazy.
You can see like you can see right in it. Like, what does anything come out of it?
Bacteria can get in there
Oh.
and cause injuries.
Will that help relieve any of that pulp
There's so
pressure?
much involved in it too.
Do they ever drill holes to help relieve pulp pressure?
I never realized how much goes into it. Right?
I would have it.
Yeah.
It's crazy. Oh, and look, accessory canal.
And then
Oh,
I know, and it was right here. I didn't even see
no,
about the blood vessels.
no,
It's like right
it's our
there.
turn.
Wait, yeah, I was about to say,
Oh, okay, that's right. All right.
do what you want.
I don't know, what do you want to do?
Anything but video.
You got it.
Just don't do video. Don't do video. Yeah, do it.
Enamel 600.
Let's try.
Talk the rest of your group, dude.
I did.
Yes.
I consulted.
She did. I
And they
don't
just
care.
said,
Go in a row.
and then they
Go
just
ahead.
said, I don't care. I don't care. I don't care.
All right, mechanical wearing away of the teeth by abnormal stresses and friction. So this is the mechanical wearing away.
I think so.
Good luck, everybody.
All right, give me an answer.
Same. I think so.
Yeah.
What is abrasion?
Very.
Yeah.
Good job,
Good job.
Jennifer. Good job.
I redeemed
I
myself.
was trying to find it. It's not
Okay, so there's 100 points right now. Good job.
Jennifer.
That sounds right.
I was like, I think so.
EDL for 600.
Done with that one. Done with that one.
Yeah, we tried.
All right, the most common type of connective tissue.
Oh
Gosh, are you kidding?
Oh harder than the 200 or easier.
That is not fair.
Oh
my God.
200.
So easy.
Real Jeopardy.
Are you kidding? 600 points. Not fair.
From now on, we know to start at 800 and work our way the other.
That's
way.
what I
I
And it would.
Oh my
All right,
gosh.
number 4.
Who said that?
I know. Enamel loss caused by increasing the tensile and compressive forces during tooth flexure.
What?
All right, so this is the loss of enamel. So we have 3 of them, remember? This is what it was for. Loss of enamel due to tensile and flexure of the tooth. So remember we talked about another part. I'll throw it out there. Indentation. What is that? If there's an indentation in the tooth.
I like the name for engine.
Well, because it's caused by tensile, we haven't really gone over this a lot, but it's an indentation of, remember last while I was in lecture and I said it, when a tooth is indented, it's like a little wedge, it looks like a wedge. I need an answer.
I think I got one of them.
You want that word?
Oh yeah, remember we were
That word
talking
for
about
that?
it.
Huh?
The word for that?
So yeah, because there's 4 types of, wear. We already talked about one in here, but there's 4 types altogether. This one is caused by the tinsel factor of it, and I use the word indentation, I use the word wedge, it's like someone is chopping it like a tree. I need an answer, I'm giving y'all way too much.
I can't think of the name. I saw the pictures,
I know.
but I can't think of the name.
Alright.
Shoot. Do you lose points if you get it wrong?
They do, because that was their question. Alright, grade 1 is passing. Group 2,
That's-
What is a Fisher? Okay.
That is.
It's alright.
group 3,
It's alright. We tried.
didn't lose it.
Didn't
That's
lose points.
true.
We didn't lose it.
no, that fraction. Remember?
Oh, no.
It's alright.
We're gonna talk about abrasion, and it's the wearing away, and then I said in that group, we have that indentation, or that looks like you're chopping wood. That's the fraction. Abrasion and fraction kind of come hand in hand. The difference is that wedging you get pretty much at the cervical turn.
Is that on the thing?
No, it wasn't. I just looked at it.
All right, who's up? 1?
I don't know.
CDL for 800.
Yeah.
How'd you do on the test?
This fiber group of the periodontal ligament does not contribute significantly
Oh
to the tooth
man,
anchoring in the
ain't that
jaw.
nice?
Yeah, but what do you know it?
Yeah, we just.
Because they may not know it.
Oh yeah. Which one? Who has it?
Oh, I don't have it. I think you do.
You don't have it.
Yeah, you have it.
All right, the answer. Read it out.
Okay, so
Significantly attached or anchorage in the jaw. So what is this? Because I'm talking about the tooth anchorage.
wait. Each tooth anchorage of the jaw. Okay, so the circular fibers.
It's their
Is that
turn.
what she just said?
Oh, I couldn't hear you. So quiet.
Is it what you said
Group
first
3.
time? Oh.
Oh,
kidding.
yeah. No, it's okay. I'm sorry.
I didn't hear us.
I didn't hear.
I didn't.
I'm sorry, y'all.
I didn't hear us either.
What was that?
Oh yeah, no.
What was it?
Gingival
the
fiber.
gingival fiber.
Group. The group.
Okay, so
The whole group that was in.
okay,
So it's
so
like
where
kind of
is the apical fiber group? 'Cause I need.
Yeah.
Okay. Apical. Well, there's apical group. So what was that? What is the gingival fiber? I don't know what I'm looking for.
Oh, there's the gingival.
What do y'all
Are y'all
want?
picking something?
What do y'all want?
Just do 600. Voila.
Yeah. Do it. I like how you said.
Didn't 600. Didn't for 600.
Yeah.
Okay, you got it.
Inorganic component, before you answer,
Yeah.
of the mature dent. I'm looking for a percentage.
Of inorganic.
Inorganic component of
Okay.
mature dentin.
So. Okay, so 70% what is 70% hydroxyapatite? Okay. Awesome.
Go big or go home.
Go big or go home. Who's that? I want her to look at this.
All right, group 3, you're up.
Hey, that's so
Don't mess with me.
70%. Smaller extensions of the coronal pulp into the cusp of the posterior teeth term. So what is the name for the smaller extensions of the pulp that are towards the coronal part of the?
Oh, nice.
Yeah.
That's a good one. That's a good question. I like
That
that.
was not a $600 question.
You guys,
You are. These
tough
are
on you.
wait,
off.
all right, then next time.
Oh no.
No.
That one question we got in that
Oh,
one question they got,
I
we're just
know.
like, what does that even?
All right.
I know.
That's an
Group
L.
4.
My pages are all mixed up now. I don't know what belongs to what.
I know.
Wait,
I have yours right here because it's stapled. That's the only one I ordered.
I was like, what the heck?
Pull home.
I don't, you know.
We gotta study. That's
What's
the
the
score.
score?
And
We have
it's
a, we have a, no more. What do we have?
1200.
We had.
We had 0, then I got 600, and then you're 600. That was 1200. I think this should be about right.
yeah.
Yeah, stop touching it.
Okay.
It's like the nervousness.
I don't know, but I'm not even itching at home.
You're just rubbing it.
Touch it, and then it just like.
It's not bad. It's just pink.
Radiopaque masses on the radiograph. It may be a problem during endodontic therapy.
I read about
We
that
did this. We just did that.
too, yeah. What?
The answer.
Okay, what is Holstones?
Yeah, that's it. Yes.
Dang it. We would have caught it.
Finally, you used that answer. They used that answer earlier. Finally, it worked. I wish these were page number because I've really got mine on. Those are like numbered.
I want dentin or cementum. I don't think it matters.
Do y'all want to do cementum or dentin?
I don't know. Maybe we should do
Okay. It's their turn, right?
Yeah.
Suppose, oh.
Exposed dentin sensitive to various stimuli. So what is this called when you have exposed dentin? That, I mean, there's a term for it. I don't think any of you guys would think this right.
This is not just us. We did it wrong.
You don't know? Okay. Group 2?
Exposed dentin sensitive.
I don't know.
Are we supposed to say which like layer?
No.
Oh, do y'all know?
Earlier, for what it is, when you have exposed dentin sensitive to various stimuli, it's called.
What is scleroid dentin?
Scleroic.
She just said it wasn't one of the flaws.
Well, that's the only thing you had to guess.
Yeah. That's why I was
Before
asking.
you guys, what do you guys?
I just have to pee.
Oh.
Oh, now it's not.
We need an answer.
Oh, I thought it was there.
No, they already answered.
Oh.
They were quiet.
It's gone all the way around.
You said primary?
You said primary?
Yeah, you said sclerosis.
They said sclerosis.
All right. Your time's up.
Tertiary. I don't know.
What is BT?
I guess.
No, it's dentin hypersensitivity.
That was way more simple than we did.
I was expecting it to be like
Yeah.
a term, like a term.
All right, which one y'all
Okay.
want?
All right. That's kind of like with. Is it our group?
Yeah.
Yep.
What do y'all want to do?
Dentin for 400?
Yeah.
Or do you want to do
Or
cementum?
you want to do cementum or 6? Either one.
I don't know. I just can't even think because I'm
Either one.
Let's do cementum for 600?
Sure.
Cementum for 600.
like I'm literally gonna wet my
What's his name? What's the guy from Little?
Alex Trebek.
Mineralized spherical bodies of cemental
It's
bodies.
or something. It's either
I know what it
cementicles
is.
or that other thing.
Yeah, I think it's that.
It's either cementicles or the other one. It's either that or it's.
This?
Oh, it's either. I think it might be cementicles. I don't know.
What is ankylosis? Ankylosis?
No.
Why did you
This
say
is tongue
something?
tied.
Wait, what?
What is epithelial rest of
I think it's cementum. I thought it a Cementicles.
Okay, is
I'm
it
not
us?
sure.
Is it our turn?
It's either that or
What
Hooper
is
Cement.
Cementicles?
Who said that?
I
Like, that was the
no,
first
I
thing she
thought
said, and
that
then we're
was
like,
what you was
wait,
gonna
wait,
say.
wait.
I wasn't sure if it was hypercementosis or cementicles.
Yeah, there's
But
the
then you
two
said that. I didn't know what you were
Literally
saying.
because we were just
But we
looking at
couldn't find it though.
It's
I knew it was. I didn't know if it was the right shape.
Okay,
I didn't-
so what did so now?
Man, we.
But they were in the hole.
So what's our score now? Oh.
Forms within the tooth after the completion of the apical foramen.
Oh. Mandy.
Oh my god, that's so funny. Me and Mandy were just talking about this and we were gonna ask her about it.
Alright, need an answer.
Oh, secondary does it. That's not what we were talking about.
Alright.
So 800, okay.
They can go in the hole.
But we'll get your.
You guys ready? Oh, you guys got this. Incessant production.
Oh, man.
At the apex of the
Cementosis.
What is it?
Hypercementosis.
Yeah. Oh, yeah, hypercementosis.
Dang, they.
That.
Yeah. See, I was confused if the last question was that or if it was cementicles. That's why I didn't say it. Because the first
You
one.
should have went with it.
I wasn't
Always
sure.
go with your gut.
Yeah.
Question again?
We really.
Did they win? Did that group win?
Yeah.
Was it good?
I knew that was somewhere.
Oh, we always got the hard question.
We did.
Yeah. We got one easy.
How many did y'all get? Did y'all get about any points?
Wait, who got 0?
I thought
Did
we
we
had.
do?
I thought we had more than 0. But
I thought we
I
did.
think I think we went back down.
You got your negatives together. Oh wait, now I added that wrong. You guys do have more than that.
okay.
Have positive. 200.
Okay.
Woo,
Yeah, 200. Man, we suck.
That means we got 2 extra points, right?
Again.
Are y'all going down? Okay, because I didn't want her to like say the wrong name. Be like, poor Mandy. Okay, just. I'm gonna get in here. I know. I'm gonna bring that. It's all good.
Put these back in order.
Okay, thanks.
It was fun.
Y'all are great.
What did they
Like,
have?
good.
She said they
We got to study.
Definitely.
Big time.
Three has 2,200.
What? 2,200? Dang. 2,200?
Just Kylie and Caitlin are so smart.
Yeah, I got y'all guys.
They do good on all their tests. Yeah.
Get second place point.
They do good on like their tests.
Can we do Kahoot STUs?
Give us an extra two.
Oh, because she's an assistant. Yeah.
Oh, yeah, okay. Wait.
And Malia's smart too because she did assisting.
Did she?
Yeah, she didn't do the whole year because she didn't end up liking it, but she did the whole anatomy part. So,
Nice.
yeah.
You're all like collaborating together. So like.
But she said there's only 5 questions. Ooh, wait a minute.
That's 2.
Ooh.
No, this is kind of close.
Wait,
I'm
what?
not sure I'm doing the math right.
It is close.
It's a tie. We both get points.
Flip is an extra 200.
It's a tie.
I mean, I don't know. We might have.
They just told us that we never done it. Just everything together. And then we got. And then
Y'all have 2,000,
We don't know. We think that's what we have, but
right?
also I didn't keep up with everything.
yeah, no, we have exactly 2,000.
You gave the space kind of, so I was just like, okay. Wait, did I? I was
You didn't do all
Man,
that.
I
No, you
really.
just kind of did this like smirk, so I just was like.
really gotta study.
Oh, I was thinking like.
I know.
Well, I just go over and all I do.
You want remind you?
Gotta leave the view.
So group 4 has exactly checked out. Yes. So group 3 wins.
What did y'all have? Y'all were negative.
Yeah.
The negative group should get some points.
All gonna be negative.
Please, like 1 point.
Yeah,
How many
maybe
points did they
2.
get?
How many points are they getting?
Actually, they had 2,600. I did the math wrong. So they got
Oh, wow.
2,600. They got 2,000.
No, so how many points do
They get 2
How
points.
many extra
points.
credit points do they get?
5 a person.
We're gonna do, we're gonna do the group is 5.
So
then
we
we have like 2.
And then we can have one.
Hey, and don't forget Nikita.
Yes.
2.
Yes!
Four.
She was only asking for 1.
Used car salesman. Alright, let's finish up this and we're going to talk about who, which are just, it's just 5 questions. So we're going to finish up. I have Nikita, Caitlin, Laura.
Oh, she's gonna be so excited.
Just give me negative. Just shoot. I'm just confident. Just give me negative.
I have never had one.
Sorry, y'all.
For your group, I have Natalie, Malia,
I haven't either.
Rachel. I have no
I'm
idea
sorry.
what that says.
I never do
Mandy.
Oh, I
I'm
forgot.
like,
I'm estimating. I have no idea what that word is.
I always said the wrong. Can you get there? Okay. Hey, y'all.
Hey, let me see. Yes. Plus 3. 127. I made 70. 333 plus.
This is the one we're going over. So the one that
I can handle that.
yes, this is the one. This is the one that has the 5 slides I just need for you to do. Okay. And then we have the last one.
Or like break up the ones that are multiple questions in one.
That would be so nice though.
Yeah, like
It would be.
All right, so I'm going to go through it, but what I need for you to know from the tooth ID, I already wrote it down. You need to know slides 1 through 6. Well, 1 being the, title page. Slides 12, 13, 15, 21, 28, 29, I know, I lied. 29 and 34. But there's only certain things I need for you guys to know on these slides. So,
1, 6, 12, 13, 15, 21,
slide 2.
28, 29, 34.
all right, so just, you guys already know this. This is just a general grouping of what teeth we have. You guys know we have central incisors. You have this, Natalie.
Well, I wanna make sure.
Gosh. Your incisors, your canines, your premolars, and your molars. We know about DAQT, how to name our teeth. So just remember DAQT, our dentition, our arch, our quadrant, and our teeth. Tooth, yeah.
Tooth name, teeth name.
Teethuses. So for here, I want you to know 1. I want you to know the difference between where that 1 millimeter is. So on our distal surface, we have it is always 1 millimeter less than on our mesial surface. So this is our CEJ. So you're getting that curvature of your CEJ. So take your tooth and turn it to the side. And when we start drawing our teeth, you're going to get your probe and you're going to see that that curvature, the way it drips down or dips in, is going to be 1 millimeter less on the distal side than on the mesial side. So that's what I'm looking at. So it's always from the proximal view that you're going to be looking for that CEJ curvature.
So we just need to know rule 1 for this slide.
1 and 3.
1 and 3.
Yes.
That's slide 3.
This is slide 3. 1, 2, 3, 4. 4 including your title page. Let me see. we'll go over secondary. So here's 6, but we're gonna go over secondary and tertiary when we get to the last slide. So just know that we're gonna get to the anatomy of that. Oh, and 4. So knowing, and this is just pretty much with occlusion. So thinking of the way we bite, we're gonna have more wear on the labial surface of our mandibular incisors. We're gonna have more wear on the lingual surface of our maxillary incisors, just because we have that natural overlapping. So thinking of except for your boyfriend, except for that overlap, we're gonna have that natural wear.
What slide is this?
This is slide 5.
Oh, it's at the bottom.
Yeah.
Right.
All right, in slide 6, knowing that the anatomy, as we go more posterior, we start getting more anatomy to our occlusal surfaces on our molars. So we start getting more supplemental grooves, get more tertiary anatomy as well. It looks more detailed as we don't have those definitive primary and secondary lines. It's just a lot more grooves in there. So we have more variation as we get to our 3rd molars.
So number 8?
So
Number
number
8.
8.
Okay.
Not 7.
No, not okay, well, knowing about 7, as we go more posterior, our roots are going to start to merge. So then when we're talking about endodontic treatment and cleaning, we have more depressions in those areas. So we don't have definitive root structures. So like how in our mandibular, we have our 2 roots that are actually definitive. We can go in there and see our furca. For our 3rd molars, they're more fused. So just know that the anatomy of the root varies as we start going posterior as well. So the anatomy of the crown and anatomy of the root start to vary, and fusion happens as we go more posterior. All right, so we're going to jump to 12. You don't need to know any. Yeah, 12. So 12, we're talking about mandibular. So what I want you to know here is take out 25 or 24, or 26 or 20, 23. And I want you to look at them. So when we're talking about the way that our teeth are and how small they are, can you really tell? Look at the lingual aspect of those teeth. Are we looking and seeing which one is wider that you can see from the lingual aspect? Is it going to be our central or is it going to be our lateral? Our lateral is wider. So our mesial to distal width is wider on our lateral. So that lets us know that our mandibular central incisor is our smallest tooth that we're going to have, which is what I want you to take away from that. I don't really want you to know the mesial distal width or which one is wider, mesial distal or buccolingual yet, because we'll get into that. But just knowing that, looking at the variation of it, when we're looking at that, they look similar when we're looking at the roots, but when we're looking at those crowns, we can tell because we have more of a mesial distal width, wider range for our lateral. So knowing that our mandibular central incisor is the smallest tooth that we have.
So just that first bullet point.
Yeah. All right, 13. I think I just need for you to know nothing really, because I mean we'll go over this later, so scratch out 13. I really want you to kind of see when you look at them incisally, but that's going more until we start talking about it. How it's straight on, so it's hard to decipher between 24 and 25 because you don't have that curvature of the distal line angle as you have with your lateral ones. But scratch out 13. You don't need to know any of that. That's just more information we'll get into.
Did we know something on the incisor slide? The one that you had on before?
This one?
No. Wait.
Number 12.
Number 12.
12.
No, just this incisor.
Just the one. I think that's slide 10. Or no, it's slide 9.
Maybe
This slide.
7?
Okay, I don't know.
Yes.
Done. No.
So not seven.
No. All right. Yeah.
It's like it's
No.
Hey, is this my lateral? Or is this my central?
Okay, so we got 15 as well because I was
You're
going to show you
asking
the
them
difference between, we're looking at from the incisal view, how you can kind of see that curvature and how it twists.
Oh, look at mine and see if you can see it.
Just know that our laterals do have a slight twist to them on a mandibular, okay? We have a rotation. Mandibular and lateral incisors have a twist to them. They're slightly torsoverted, as with our mandibular central ones are straight on. We have those 90-degree angles, but look at that twist that we have here. So just know those differences if I were to ask you between central and lateral.
Do we know like what direction the twist
No,
is in?
nope.
Just know that it's not straight.
That it's not straight, yes, because we'll go into the direction when we start talking about incisors in another week.
The laterals have a twist and the centrals are straight.
Straight
That's
on.
what we need.
Correct.
Okay.
No, well, yes, because when we go into our maxillary ones, it's just pretty much the width of them, and that's how you can tell them apart. This one, you're kind of looking, because they're so small, that you're looking at for just those little different types of discrepancies in between. So yeah, you don't really have a very, your canine is twisted, see, but we only have our canines, that's when we go into our maxillary mandibular. But when we're comparing like lateral on a mandibular, this is gonna let you know which one is gonna be on the right and which one is on the left. This is gonna be our mandibular, yes.
That one's a lateral, one's
You may wanna take it out.
But isn't it not
Mandibular.
No, I mean like the inside.
So yeah, look at the incisal edge. And these aren't really good.
I was gonna say, I don't feel like they're very good.
This isn't very good.
Okay.
But when I show you natural teeth, when you start going through the natural teeth and I have real teeth you look at. All right, this is 15. We're gonna jump to 21.
I think that's just.
Let me remember what we have on here.
Yeah.
Ooh, yeah, so maxillary first premolars. What did we talk about here? So we were just talking about this earlier. What's so great about maxillary? What's different, I should say, about maxillary premolars?
The number of roots they can have.
It can't be right. Well, bicuspid, it could be bifurcated, right? And then what else? It can also have what? Two what? Two canals, remember?
So it can be two roots, can be bifurcated into
And
two canals.
two canals, correct.
Does the canals correlate with the?
Sometimes, because remember the mandibular canine can have two canals, but it's only going to have that one, right?
Two canals, two roots.
Yeah. And we'll get more into that when we
Bifurcation.
start talking about this. I'm just kind of giving you a synopsis of everything. Okay.
So
So
bifurcation.
they have two roots, but the one that I want you to get in here, which is I think is on your root morphology one, is talking about